Let me start with some remarks about COVID. We're entering a really different period of this pandemic. It is not the end of the pandemic, but it is definitely a new phase. The numbers are all coming down, as I think everybody knows. The governor reported yesterday to the cabinet that Hawaii is currently the best in the country in our case count, our hospitalization levels, and our death levels. And that is surely a result of the very firm measures that our state has had in place at the state and county level. The executive orders or executive proclamations that have been in place for just about 2 years now will end completely on March 25th. So there will be no emergency proclamation for anything relating to COVID-19. The Safe Travels program is ending. The governor's mandate that public employees be vaccinated or test weekly is ending. Indoor masking requirements are ending. All outdoor masking mandates have already ended. And at the county level, there is no requirement of any kind that private businesses check vaccination statuses at the doors. That was in place for restaurants, bars, shops, grocery stores, pretty much everything. I'll say a little bit more about the federal budget later on, but one element of the new federal budget that was just signed into law by President Biden is that there is no direct funding for COVID-19 response. So we are also moving to the end game in terms of free federally funded testing, vaccination, and the sites that we've all become accustomed to. Those services will need to shift over to business as usual to be covered, hopefully for most people by health insurance. So as we move on within the university, we're looking at doing so, I would say sensitively, but firmly. We were the first entity to really implement strong controls, such as the decision to go online in spring 2020, 2 years ago, following spring break. We were the first entity to announce a vaccination mandate for students and employees. And interestingly, we are now among the slowest in our return to normalcy. And I think we're pretty comfortable with that. I think we're on a slow march back, but we cannot ignore the changes in the numbers and frankly, the changes in the community around us. And all of us must become much more accustomed to seeing many more maskless people, seeing people closer together than we have for the last couple of years. That will be a relief, but we also need to recognize that it is worrisome to some, and especially to those who have underlying conditions or other reasons for vulnerability. So we will be making some changes effective March 26th. That's the first day under which there will be no emergency proclamation. And I will call these fairly lightweight and frankly obvious changes. We'll be eliminating the masking requirement outdoors of all kinds at any events. We will be continuing to require masks in classrooms, shared lab spaces, and other kinds of tightly confined spaces, such as advising offices around our campuses. So we'll try to stay pretty consistent with practices that are emerging in our communities. We will still require masks for those who have been exposed to COVID-19 in keeping with CDC and Department of Health guidance. We will continue our vaccination requirement through this semester. That's what we had announced for all employees as well as for students. We are looking now, we will be continuing that for the summer. As I had previously announced, but we were looking pretty frankly at what kind of requirements and mitigation measures we want to have in place for the fall. And we are carefully watching what other universities in Hawaii and around the US mainland are doing as well. No travel restrictions for us on return to work, pretty much all of the routine things you would expect. We are looking closely at some of our potentially riskier activities, such as residence halls, athletics events that are indoor and the like. So those are still a work in progress. So as we loosen restrictions, we also need to be aware that at any time, should the numbers change and conditions change, we will be prepared to pivot back to greater safety. This morning on public radio, I heard a comment from the White House's new COVID advisor who said, think of masks like a raincoat. You wear it when it's raining, and when it stops raining, you take it off. But you have to be prepared that when it starts raining, you're going to put it back on again. And that's how responsive we have to be, I think, with our measures as well. Let me shift now and say a little bit about the SCR 201 or tenure task force and the next steps. You will recall that last month you accepted that report after considering both the SCR 201 task force report and the tenure PIG working group report that you had accepted last year and deferred action on until seeing both reports together, given their overlapping missions. And last month, you charged the administration to work with UPA and the faculty to implement the next steps of that recommended in that SCR 201 task force. So without belaboring this, there were 4 recommendations. Some had subparts. I have met with Associate Vice President Halbert, who was on the SCR 201 task force and was a staff for the tenure PIG, along with Christian Fern and Debbie Hartman of UPA to take an initial step to implement the Regents' directives. What we have done is agreed we will meet together initially, probably weekly, to ensure that we make continuing progress on all of those actions. We have divided those 4 items and their subparts into what we believe are separable tasks. We will keep for ourselves as a kind of steering committee responsibility to identify the right people to work on each of those tasks. We will also be considering which of these tasks require potentially changes to Regents policy, changes to executive policy, changes to collective bargaining agreements. We will work through that process, and we've agreed to manage the consultation that is necessary and is different for each of those potential changes. We think most of this work is pretty straightforward as laid out in the SCR 201 task force. The most challenging item will be to address the recommendations relating to our specialist faculty, which are also would apply to our community college non-instructional faculty. And we have not gone into any detail on that yet, other than to agree that at our next meeting, which will be Monday, we will identify the right kind of working group, bringing in far more faculty to participate in that discussion and provide recommendations that will then go through the appropriate consultative processes. Let me next say a little bit about the strategic plan, which I've talked about with you in the context of the reimagining discussions. I did commit during that last presentation to do our best to have a strategic plan prepared for board approval this calendar year. Where we are so far is that we have invited all of the governance groups around the university to provide us names. We expect to be inviting a steering committee of about 15 to 20 people, students, faculty, staff from across the UH system. We expect to invite them to join that steering committee tomorrow or by tomorrow. We are looking at a first meeting on ideally on April 1st. And this will be a group, and we're letting people know that we expect it to work over the summer. We simply can't take 3 months off and get this work done in a reasonable manner. That would require extensive consultation during the fall when our students and faculty are back to our campuses. We're excited about the work. We're excited about the names that we got from our student, faculty, staff, and Hawaiian Council representatives, as well as the names we received from our campus leaders who they believe can represent their campus directions and objectives as well. So more to come. Our goal is to have this ready for the November meeting, but heads up and warning that we may request a special meeting of the board in December if we aren't quite there, having finished our consultation processes during the fall. Let me shift to a couple other topics now. First, fundraising. I think everybody has seen the news about the fabulous second major gift from Dr. Priscilla Chan and Mark Zuckerberg, who are, I think everyone knows, part-time Kauai residents. The first gift that we had announced a few months ago was focused on ocean conservation and health. The projects will be statewide. This second gift is really focused on their second home, the island of Kauai. And one of our most vital needs that we have been talking about with the legislature for a number of years, with donors for many years. And so we're really delighted at their willingness to step up to the plate and help us provide more medical education on the island of Kauai. We know that the best way to get more healthcare professionals, and particularly physicians somewhere, is to find people from the community, train them in the community, and have them then willing and able to practice in the community. I'm not going to say much about that gift because we have Dean Jarris Hedges on the agenda a little bit later for an item related to graduate medical education, the training of residents, and that's a challenge we have throughout the state. So if you have questions, I just want to thank the UH Foundation, which really found the way to open the door to CZI, is the Chan Zuckerberg Initiative, and that's where the donations formally come from. But they got that door open and really have facilitated the conversations that have resulted in these two gifts. And we continue to be in discussion with them, and we hope to inspire other part-time residents of our islands to engage similarly with us on their islands and statewide to contribute to Hawaii. So what I will say though is that with these gifts, we are at $143 million raised this fiscal year. That's an amazing number. Last year at this time, which was an excellent year, we were at 69 million. So we were more than double where we were last year. Vice President Dolan tells me we do not have another $50 million gift in the queue for this fiscal year, but we will keep working at it. And congratulations to him and the team and all of the UH leaders who have worked with the foundation really closely to bring these gifts home for us. Our story on research is also very positive. It's not a doubling. Get to work on that, Vice President Sirmos. But we are up over 14% right now, year over year. Our total to date is $396,967,109. So just under 397 million. Compared to last year, we were at about 347 million. So we're up about $50 million compared to last year, same day, and that's about a 14% increase. We are well on our way to a record-breaking year of likely over $500 million for the first time in our history. Relatedly, I want to comment on the federal budget. As I think you know, earlier this week, Tuesday, President Biden signed the Consolidated Appropriations Act for this fiscal year. So just about halfway through, not great, but at least they got it done during the fiscal year. And this provides the funding for last October through September 30, 2022. There were, I'll just say it's an excellent year for UH, and we'll be putting out a press release on it later today. A couple things have happened. There's a little more flexibility on how we can use our HERE forms. There is an increase in the maximum Pell Award amount of $400 for the first time in years. That will be very welcome for our students who have financial need. They reauthorized the Violence Against Women Act, which is great. There are requirements for colleges and universities to conduct campus climate surveys, something that we routinely do and is baked into our standard processes as well. They are continuing the work for the FAFSA simplification that we were anxious to have done, but they've given the Department of Education a little more time. So that's unfortunate for the students who will have to continue to complete the more complex FAFSA, which we know is a barrier to getting financial aid into the hands of students. Substantial money for Red Hill and addressing the water crisis. I think you've probably read about that in the papers. So I won't say much except to let you know once again that UH is a part of that, and Vice President Sirmos has been interacting significantly with both the DoD and the Department of Health, and I believe EPA, to have us with our expertise participate in some of the testing and some of the studies needed to understand the health of our water systems, our groundwater and our water systems. Lots of help for many of the programs that assist students in need, the Special Educational Opportunity Grants, or SEOGs, Federal Work Study, TRIO, Gear Up, graduate assistance in areas of need, additional help for strengthening the ANAPISI, Asian American and Native American Pacific Islander serving institutions, of which all 10 of our campuses qualify. Also, additional funding for strengthening Alaska Native and Native Hawaiian serving institutions, the ANNH program, again, for which all 10 of our campuses qualify. So those are funds that we have to apply and compete for, but it creates great opportunities for us to do better for our students who have been underserved and need us most. Also increases of funding in areas like NIH, National Science Foundation, NASA, NOAA, National Endowment for the Humanities. These are all welcome increases in federal funding for the agencies where we compete for funding based on the excellence of our students and our faculty. In terms of some other federal programs that support increase, alternative energy research programs, our Hawaii Natural Energy Institute is a major beneficiary for that, as well as from the Office of Naval Research. Multiple programs for like NASA's Minority Serving Institution, for which we qualify, a Center for Indigenous Innovation and Health Equity, which is a UH partnership with Oklahoma State University and the University of Alaska. I think it's probably hard to follow it, so I don't want to drone on about this, and we'll get this into your hands quickly. But what we really want to do is, and all of you as well, please thank our congressional delegation, all of whom have been actively working on behalf of the state of Hawaii and the University of Hawaii with programs that will really help us serve our communities on every island. And each and every one of them has done their part and has supported us as this move forward.